about 30s, stage 1 to 4. You can see from the pictures uh, how it looks like, how it changes, and how it develops, how the tumor develops. But I'm going to go down to the obvious. Uh, Key facts given by WHO on 2nd December 2025 last year. Uh, it's preventable through HPV, and regular screening is recommended by national guidelines. Be cured, detected early, and treated early. So it's the fourth common cancer in women globally, with 660,000 new cases, 350,000 deaths in 2022 alone. And of course, low and middle income countries are affected with high rates. Of course, major inequalities is driven by lack of national campaigns, HPV PAP campaigns, cervical screening, lack of treatment services, social, where countries where women are not really given that priority in gender, they're not taken seriously, and of course, finances, and of course, human papilloma virus is the infection that causes cervical cancer. HIV in women are 6 times likely to develop cervical cancer as compared to women without. Of course, there's the 90-70-90 target that was put up. 90% of the girls fully vaccinated. 50 by at the age of 15, 70 screened between 35 to 45, and 90 with precancer or invasive cancer receiving appropriate treatment. 90, 70, 90. So that's it. Uh, just like I said, caused by human papilloma virus. That's like in the key facts given by WHO. Regular pap tests, early detection, and prompt treatment are key for cure most the fourth cancer in women globally, especially in low-income nations. Well, whatever else in the key facts, I'm just going to repeat them. Of course, there is the symptoms early, often none. So it's something that you don't know, but of course, it's all about screening, early screening. And without screening, there's the period, there's the vaginal bleeding between periods, after sex, menopause, abnormal discharge, pelvic pain, intercourse, pain, of course, leg pain, swelling, back pain, backaches, frequent urination. Of course, there's the prevention and screening. HPV vaccination is caused by effective against cancer causing HPV types, regular screening, uh, pap test, HPV test to detect changes before they become cancer. Then there's the 90-70-90 campaign that is there from the WHO targets. Uh, 90 vaccination, 70 screening, 90 treatment for early cancer. Of course, there's the options such as chemotherapy, radiotherapy, targeted therapy, immunotherapy. There's the prognosis and statistics. The whole idea of cancer is it's about the early priority, early treatment, early care. Um, if caught early, there's a rate of survival, 5-year rate, and of course, for early stages, dropping if spread nearly to 60%. And then there's the global burden of women in low economic countries, highlighting the access of disparities. Just like I said, cancer is all about early detection, early screening, and prevention, taking care of yourself. And in this life, of course, you cancer, that's the whole idea. And moving forward, it's up to you to, during this month, to get yourself screened, checked. And with that, I want to thank you and subscribe, and we'll talk more soon.